Patients can be very vulnerable to the development of chronic wounds from a variety of reasons in the medical setting that can include elective surgery, burns, and ulcers. Many times, patients have recurring infection and wounds, even after months of being treated with antibiotics and antimicrobial dressings. If not treated effectively, chronic wounds can lead to health complications, and in extreme cases, the loss of a limb. Why are these wounds not healing effectively? A biofilm is a community of microorganisms that surround and adhere to living and non-living surfaces, such as a wound, and which produce a kind of gel-like slime. This biofilm, which cannot be seen by the naked eye, consists of 80% bacteria and creates a protective shield-like barrier against outside immune cells and treatments. More than 90% of chronic wounds have biofilms, and it is the major cause of infections acquired in a health facility. This in turn creates a chronic inflammatory response that prolongs wound healing. Biofilms are impenetrable by antiseptics, antibiotics, and antimicrobials. Bacteria can transfer among themselves biological material, such as antibiotic-resistant genes. Planktonic bacteria attach to the surface of the wound, forming irreversible attachments within 2 to 4 hours, creating a slimy area called extracellular polymeric substance, EPS. The bacteria remain embedded in the EPS, which protects them. This layer becomes increasingly resistant to antibiotics and antiseptics within 6 to 12 hours. The biofilm quickly matures within 2 to 3 days, which then releases bacteria into the environment to settle elsewhere. When removing biofilms, the wound has to be washed in a clean environment, as the bacteria can be transferred to different areas which can cause infections. If the mature biofilm is not removed mechanically with the correct irrigation pressure, it reforms within just 24 hours and will be back in full strength before the next wound dressing change, causing a delay in wound healing. Comfort Heal, a contained encapsulated wound irrigation system that contains all fluid while performing pulse lavage therapy. The Comfort Heal contained system collects the saline solution that irrigates the wound and simultaneously solidifies the fluid in the collection compartment. Applying the Comfort Heal encapsulated system allows extending the cleansing action and infection prevention until the next wound dressing change. Also, the whole procedure can be done at any bedside location. A 10 to 15 psi pressurized pulse wound irrigator mechanically removes biofilms from wounds and can be applied to all regions of the wound, including tunneling with specialized design cone and tube tips. Comfort Heal wound bags are divided into 2 categories: AB, used on abdominal wounds, and EB, used on extremity wounds. These wound bags are specially designed for a watertight seal around the wound, with correctly located procedure port openings for protective pulse irrigation. Comfort Heal encapsulated wound irrigation system reduces chance of a secondary infection by eliminating aerosolization and splashback. Does not require suction or equipment for increased patient comfort and caregiver convenience while conducting treatment at the bedside. Can be used in many patient settings, such as acute care hospital, long-term care facility, outpatient physical therapy setting, with reduced risk of contamination. No need for special setup or extra cleaning and disposal. Dispose as general medical waste. Reduces cost of handling biohazard waste and easy management of medical waste. Assists in improving wound recovery times, leading to less patient pain and suffering. Reduces hospital and rehabilitation facility admissions and readmissions. Increases efficiency of management and patients' satisfaction. For your quick and safe recovery, Comfort Heal. For more information and training, call your regional sales representative today.